Hello teacher, my name's V. I'm first year of preventive medicine specialist. Today we'll talk about a dangerous disease of respiratory symptom called tuberculosis. An abbreviation is TB. So talk about TB disease. TB affects the lungs and it caused by bacteria called Mycobacterium tuberculosis. This bacteria spreads through air when the patient cough, sneeze, or spit. About a quarter of global population is estimated to have been infected TB. They call latent TB, and from 5 to 10% of them maybe get symptoms and develop TB disease. It's called active TB. There are 4 conditions get a higher risk of TB disease. The first one is diabetic, and the second is weakened immune symptom such as HIV or acquired immune deficiency syndrome, and the third is malnutrition, and the last one is tobacco use. So what are the symptoms of TB? For latent TB symptom, the patient they don't feel sick and aren't contagious. And with active TB patient, they will have symptoms. It may be mild for many months or many years, so they are easy to spread TB bacteria to others without knowing their disease. Here are some symptoms TB patient may get. The first is prolonged cough, about over 2 weeks. Maybe patient may cough up blood or hemoptysis. Next is chest pain, weakness, fatigue, weight loss, fever, and night sweats. Symptoms depend on the organ TB become active. Over 80% TB occur in the lung. Besides, it can affect the brain, kidney, spine, and other skin. So how can we diagnose TB? For latent TB, there are 2 tests can diagnose this. The first one is tuberculosis skin test, and the other is interferon gamma release assays. For active TB patients, WHO require use rapid diagnostic test, a gingivitis in sputum to diagnose TB. For children, it is difficult to diagnose, so we can miss TB patient in children. So how about the treatment? There are many regimens for latent TB, growth-sensitive and growth-resistant TB. For growth-sensitive, there are 5 antibodies to treat TB. Here there are streptomycin, isoniazid, pyrazinamide and ethambutol. The medication take daily for 6 months, and now they decrease the term of regimen only 4 months regimen. With the patients get drug-resistant TB, they have to treat for a long time, from 9 to 18 months regimen, and patient will have many adverse reactive. About latent TB, they will treat by 3 months with two kind of drugs, is rifampicin and isoniazid. So how can we prevent TB? For newborn, we have Bacillus chemical BCG vaccines is given to newborn during the first 24 hours after birth. But these vaccines will prevent TB outside the lung. So even though you get BCG vaccines from newborn, you maybe get TB disease in other children. So for the other children, how can prevent TB? The first is you seek medical help if you have symptoms suggestive of TB, maybe fever, prolonged cough, hemoptysis, night weight loss, and so on. The second is you must get TST or IGRA test to diagnose latent TB if you are high risk of TB disease. And once you get latent TB, you need to complete the full course. It means you must complete the full regimen treatment, because if you don't complete it, you can maybe get TB disease. And the last is, if you have TB, you need take some actions. The first is washing hands with hygiene or soap when you cough, and the second is wearing mask even though you are at home or when you go to public place. And the last is using tissue to dispose your sputum, because sputum is the place to conduct TB bacteria. So it is on information about tuberculosis. Thank you for listening, teacher. That's all. Thank you.